We know that now in first line we have three options. The first one is cis-gem, carbo-gem plus avelumab as maintenance. The second one in cis-eligible patient is cis-gem plus nivolumab and then maintenance with nivolumab. And the third one is Enfortumab vedotin plus Pembro. So the point here is I think we are in the new era where we start to think about personalized therapy for metastatic urothelial carcinoma. So I think now we need to have more data and more idea on which is the best treatment for each single patient. Mainly what I do in my clinic and normally during my consultation, I think about three main factors. The first one is patient characteristics. That means creatinine clearance, ECOG-PS, comorbidity, of course, age, but is much more biological age instead of chronological age. And then I think about disease characteristics because we have to think about if we have a local advanced disease, so only lymph node disease or metastatic disease. Even the side of meds, I think it's important to choose the right treatment for our patient. So liver meds, bone meds, maybe for this patient the best treatment could be just EV-Pembro. And then I think we should think about the primary tumor as well, because patient with upper tract tumor, we know that the median overall survival is quite good compared just chemo, and this data is not available with the other two combinations. So I would choose for this patient the new combination with EV-Pembro. And then we think about to discuss with the patient priority for the treatment, because behind what is the medical condition, there is a patient, there is a family. So I think we should discuss about where he lives, which is the person, if he lives alone, there is someone with him, because in that way we could choose one treatment or the other treatment. Of course, maybe if I have a patient that where I should offer cis-gem, I would consider in this period if the patient stay alone at home or not. Even EV-Pembro have to consider if the patient is a long responder, could be a neuropathy, and that could impact the quality of life of the patient if live alone. So I don't think there is only one solution. I think we have discussed with the patient and we have to consider all these factors. I think the majority of patients can and should receive EV-Pembro. Then we have a patient where we have more than one option. We could offer cisplatin-gem and avelumab, or cisplatin-gem and nivolumab, and we have discussed with them. And then we have a minority of patients where we have just one solution for him. And so a discussion is important, yeah, but we have just one only solution. Maybe patient with advanced disease or upper tract, liver mets, bone, patient with bad performance status to the pain due to the disease, I think they have just EV-Pembro as only treatment they can receive.